Hello again, everyone. Today we'll start out with Dr. Van Deelen, Chief Medical Officer at St. Luke's. He's going to be followed by Dr. Sarah Manny, Chief Medical Information Officer at Essentia Health. Dr. Manny is going to discuss what goes into surge planning and what we can expect in the Northland as this pandemic continues to play out. She also has invited a couple members of her team to help answer questions if needed. They are Steve Waring from the Essentia Institute of Rural Health and Niall Klein from Enterprise Analytics. Our infectious disease experts, Drs. Prabhu and Thompson, are here to answer your questions as well. We'll aim to wrap things up around 12:15, leaving a few minutes at the end in case any of the doctors have a few closing thoughts they'd like to circle back to. And with that, I will now turn it over to Dr. Van Deelen.
Thanks, Louis. Good morning, and thanks for joining us today. I'd like to start today by addressing Governor Walz's executive order to allow elective surgeries and procedures to resume. St. Luke's appreciates the governor's careful approach to restarting elective procedures. The delay in the surge of COVID-19 patients that resulted from the governor's stay-at-home order and Minnesotans' adherence to social distancing has bought us critical time to build up supplies of important medications and equipment, including PPE. We are far safer now than we were even a couple weeks ago, and we are confident that we will be able to continue to provide the exceptional surgical and procedural care our patients expect. We also have a plan in place for how to best care for patients in the midst of the surge, which includes a process for caring for our patients with surgical or procedural needs. We know that many of the procedures and surgeries that 6 weeks ago were elective aren't elective anymore. They need to be done. We'll keep a close eye on the COVID-19 cases at the same time, with the understanding that if procedures need to be modified or cases placed on hold, they will be. Patients will hear from St. Luke's about their procedures, and we will resume them Monday, May 11th. I'd also like to note that St. Luke still has in-person appointments for many, but for others, it's more appropriate to have a telehealth video visit. For patients who don't have a device to use for telehealth video visits, St. Luke's has an option to help them connect with their providers. That's our curbside clinics. Telehealth video visits are used to help patients complete regularly scheduled visits with their doctors. For those who don't have the technology, they can schedule a curbside clinic visit. These visits will take place in your clinic's parking lot. You arrive just like you would for a typical appointment, but call once you've reached the parking lot. At that time, one of our medical assistants will meet the patient at their car and provide them with the technology to video conference with their provider. These appointments are very secure, and it's a way for our patients to connect with their providers when they have no other options during this pandemic. Another thing I'd like to highlight is St. Luke's virtual visiting program. St. Luke's has been able to distribute iPads to all St. Luke's inpatient units. Since we have limited visitors due to COVID-19, this gives patients and loved ones the opportunity to stay connected. To further facilitate this, we have developed a space in St. Luke's Hospital's main lobby for those who don't have reliable internet service or don't have appropriate devices. We can provide them with devices in a safe and comfortable place to communicate with their family member or loved one in the hospital. St. Luke's virtual visiting program is a great way to allow our patients to connect and have the visits that are important to their healing. And we're proud to offer this service to our patients and their loved ones during this difficult time. Thanks to so many who have donated their tablets to help with this program. I also want to take a moment to update you on our Land of the 10,000 Masks campaign with Essentia. After the first week, we collected almost 1,400 masks between both organizations. The Land of 10,000 Mask donation campaign is a great opportunity for us in the community to come together to ensure everyone is properly protected from COVID-19, thanks to the generosity of Northlanders. If anyone would like to donate masks to St. Luke's, you can drop them off at St. Luke's Foundation in the Northland Medical Center on the St. Luke's campus. Finally, I'd like to thank the City of Duluth, the Duluth Police Department, and the Duluth Fire Department for their incredible gesture to our nurses yesterday. Your show of appreciation for our nurses meant a lot to all of us. Now, I'll turn it over to Dr. Manny.
Thank you very much, Dr. Van Deelen. My name is Sarah Manny. I'm Essentia Health's Chief Medical Information Officer, and I work with a strong group of research and data scientists, and we've developed dashboards and projections that help guide our leaders with operation planning for COVID. In addition to our internal work, we're participants in the Minnesota Hospital Association CMIO group, which meets weekly to review the projection models that are shared amongst the health organizations in the state of Minnesota. Our models are shared regularly with our local leaders, but also with regional hospitals and community leaders on a weekly basis. Our team has been closely following COVID trends across the country and across the world. And as more information becomes available about this disease, we input it into our models. The team has been observing a trend about the nature of the surge, and we feel it is urgent to communicate this to our staff. We are very likely not going to experience a sustained surge, and due to the nature of this disease, the availability of testing, and the effect of social distancing, we will very likely experience spikes and waves. Thanks to the work of Colleen Brown, a designer at Essentia Health, we have a wonderful education tool to share with our teams, and I'm going to give you a few glimpses of it today. Unfortunately, I cannot compile it into a 5-minute presentation, and I will skip a few slides. I'd like to highlight the ones that are important. One moment while I share my screen. So here you will see questions that we commonly get about what the surge is. And I will flip through some informational slides here. We're uncertain. That's how we feel about what we're going to experience here in the next several months. This slide defines the surge. I will quickly move through that slide. And what we know about the surge again. What's important for us to know are the reasons for this variability, and we list the top 3 here: social policies, testing, and disease behavior. And unfortunately, I will quickly click here, but you'll see with social policies, there's certain things that will affect our models, the testing availability, and whether we're able to test people who are asymptomatic. We might discover that there's more people that had COVID than we originally thought, and that would affect our models as well. The behavior of this disease is also very important. It is a new disease, and we're learning more and more as we find out what happens across our country and across the world. This graphic explains a little bit about what would have happened if we had no interventions, and it's an interactive, so I'll click through here. If we had no interactions, we would have expected a very high peak. With social distancing, you can see that that peak has shifted and moved, and it also has flattened. What we're very interested in is whether social distancing that was implemented and then lifted will have any effect, and you can see just an idea of how that may look. This is a very important message that we would like to communicate, that we think that the peak or the surge may look like a wave or several waves. It perhaps could look like a plateau, a spike, or a sawtooth. And it's possible too that we'll see multiple waves and surges as we move forward. We can learn from the past, and very exciting graphics here that will show you what cities did throughout our country in the 1918 flu pandemic. And this is an interactive where you can hover over and see what different cities did. And I would like to highlight Minneapolis. Minneapolis had the lowest death rate overall. They implemented social distancing early and for a longer period of time. So we have very good history in our state of doing the right thing. This is a very important message as well. There are so many variables that can cause changes in this model. The peak numbers are very unstable. We are unable to tell with great certainty what that peak will look like or what that peak means.
Dr. Manny?
Yeah.
I hate to jump in here. We're not seeing your slides, and I'm wondering if you can try and share them a different way.
I'm so sorry. I was sharing them the whole time. I apologize.
There we go.
Can you see them now?
We can, and I think it's okay if you want to back up a bit. And
Would that be okay?
that would be
It is a
absolutely
really
fine.
amazing graphic, and I do
Yep.
apologize.
No,
So
that's okay. We wanted to make
going-
sure we were seeing them, so thank you.
I'll reload and we'll restart. Is it okay to start at the beginning because the graphics are good?
I think that'd be important to do. Yeah.
Okay.
Thank you.
So the search questions that I have are listed here. And uncertain is how we feel, and we want to recognize that. This graphic talks about the surge. I'm going to quickly move through these two. And to show you there's 3 different variabilities that we highlighted: social policy, testing, and disease behavior. This is an interactive graphic, and it talks about the specifics of social policy, testing, and disease behavior. This graphic here talks about what would happen if we had no interventions, and I'll click through. This is just an example, does not exactly represent our model. If we had no intervention, such as social distancing, we would have expected a much sooner peak with a very high type of that peak. Social distancing, as you know, implemented shifts that peak and it flattens that curve. And this is what we are not unsure yet here, but we suspect with social distancing, when it was implemented, it could shift it and then it could resurge once the social distancing is lifted. The peak of the surge might not look like a peak. We expect it to look like a wave, plateau, or spike. We expect multiple waves and surges with this illness. And here's the graphic I was describing, which is really cool to see, and I'm glad that you recognized you weren't seeing my screen. We have information from the 1918 flu pandemic, and I won't go into those details, but you can see here that Minneapolis had the lowest death rate in the 1918 flu pandemic because of the social distancing and how it was implemented early and for a longer period of time. This is the message that we would like to get across. There's many variables that can be caused into this model, and the peak numbers are very unstable, and we are unable to say with certainty when we will experience a surge. What we don't know, there's several different things, and we highlighted 3 of them, and I'll quickly just click through them, and I apologize, but there's factors about the infection, there's factors about immunity, and the weather. Now that things are getting nicer, we don't know how COVID will behave in the warmer weather. What does it mean about second and third waves, and can we predict those? That's a question that we often get. We're working on several different surge scenarios. We're looking at data from all over the country and all over the world, and every day we have our team looking at this and inputting new data into our models. So finally, what's really important to know, and the messages that we would like to get across, is that we have people looking at this, our analysts and our researchers, and we're trying to keep up to date as much as possible. We are sharing that on a weekly basis with our community members and leaders. These predictions can change at any time, and there's many variables that go into it, as you can see from the earlier part of this presentation. We want everybody to recognize that we are likely going to be seeing various peaks, waves, plateaus, or sawtooth patterns, and likely there will be more than one surge until vaccinations or immunity are widespread. And finally, we're just going to get through this together. And thank you very much.
Thank you, Dr. Manny, for that great presentation, and thank you to Dr. Van Deelen as well. We will now open it up to questions, and again, as Shannon alluded to, you can ask those via the Q&A function at the bottom of your screen, or you can simply raise your hand and ask those questions out loud. Looks like Adele from the News Tribune has a question. Adele, was that your hand up?
This is Adele from the Duluth News Tribune. My question is about elective surgeries. With elective surgeries starting again on Monday, will there be people who have been furloughed that will be coming back to work? If so, how many?
John Pryor here from Essentia. We do anticipate bringing a select group of employees back from the special COVID-19 administrative leave to support the return of elective surgeries and procedures. We don't know exactly how many yet. We're going to start slow with the procedures and be very careful in how we do this. We're going to be watching our PPE and making sure that we preserve enough for the surge. And so I think over time we'll be able to tell how many procedures we can do and how many people we can bring back. So we don't have the exact numbers, but we look forward to bringing a select group back for this.
Yeah, Nick Van Deelen, St. Luke's. I don't have numbers either. I would just echo Dr. Pryor's comments that we're going to be doing this carefully. We have a plan in place, and we'll be bringing the staff back necessary to help us start slowly and deliberately.
Alejandra,
Hello, can you hear me?
we can.
Okay, great. Well, thank you. I was just wondering if you guys are able to discuss that plan you guys have in place to ensure that the workers and the patients will stay safe during these elective surgeries.
St. Luke's, I don't have. Sorry. So Nick Van Deelen here again. So our anesthesia and surgery team has been working for the last couple weeks to go over the process of how we prepare patients for surgery, making sure that we're utilizing testing protocols so that we can keep patients and staff safe. We've revised our PPE recommendations for staff throughout the operating room based on changes recommended in the setting of COVID-19. We've gone through our procedures and have worked to minimize our PPE utilization by making sure that we keep the appropriate number of staff in the rooms at all time and that we're minimizing that turnover. In addition, we've worked on our even things like airflow in the operating rooms to make sure that some higher risk procedures are done safely. We've set up a series of dashboards that we monitor all of our critical supplies, and we'll be watching them very closely. In addition to, again, monitoring the amount of disease in our community. As Dr. Manny said, this may be a sawtooth pattern. As we start to see a rise in the amount of COVID disease and the amount of hospitalized patients, then we may have to ratchet back our surgeries again in order to conserve critical equipment and supplies. So there's a very detailed plan, and we're confident that we can do this and keep our patients and our staff safe.
John Pryor again from Essentia. So I'm going to echo a lot of what Dr. Van Deelen said, and we do virtually the same. We have virtually the same approach, and that's not surprising since we kind of exchange notes a lot and we collaborated very closely with St. Luke's. So we're following the guidance that the governor and Minnesota Department of Health issued on May 5th, and they broke it down to community considerations. So following what's happening in the community and being prepared in case there is a surge so that we ratchet back to surgeries, screening and testing. And so screening our patients beforehand, we are going to be doing testing of our patients 3 days before surgery, and then ask them to quarantine themselves so that we know that they don't have COVID-19 when we do the procedures. Patient considerations, making sure that we have a minimal amount of visitors and minimal amount of patient flow around when the patients arrive for surgery, that we minimize movement, that the patients are wearing masks, that the staff's wearing masks, universal masking, and everyone is protected. Watching is our PPE and our supplies, making sure that we have enough, again, in preparation for the surge that at some point will likely happen. And then meticulous infection prevention, including those airflow changes and negative pressure rooms and just lots of sterilization. So those are the guidelines from, as I said, the governor and MDH, and we're trying to go above and beyond those, and again, sharing lessons with our colleagues at St. Luke's.
Looks like we have a couple of follow-up questions. Alejandro, we'll start with you.
Oh, sorry, are you able to hear me?
We are, yep.
Okay, just wanted to make sure again. Yeah, just another follow-up question is wondering if both Essentia and St. Luke's are stocked with the PPE supplies needed throughout this?
Yeah, Nick Van Deelen again. We are. Our materials and purchasing department has been working really hard, oftentimes in collaboration with Essentia and our other regional partners to source materials, some of them locally, and we've talked about them before. There's been a lot of innovative work done. There's been a lot of work done to identify new sources because, as we alluded to a couple weeks ago, the normal supply chains had really been disrupted as supplies had been directed to other parts of the country. Over about the past 2 weeks, that has improved to the point that we had the ability to build up our supplies of things like even N95 masks that were really difficult to come by. So we feel good about the supply of PPE that we have currently. Again, we monitor that so closely because as everybody starts doing elective procedures again, that's when we start utilizing more and more of our PPE. So that's why we need to do it slowly and deliberately and be willing to slow down if we need to, depending upon, again, maintaining that supply going forward.
John Pryor from Essentia. So I'll echo that. The answer is yes, we definitely have enough supplies right now, but it's something we follow closely. And Dr. Manny, I wonder, I can't remember, were you involved working with Brian Zuck on that really great dashboard that we look at how many supplies we have and the burn rate? Would you mind describing that?
Yeah, our teams have developed a dashboard looking at our intake and where we are in our supplies of many different supplies. So it's been a great analytics work that we are delivering to our leaders to help us know. So we know at any moment in time where we're at with our current supply and where we are with our stockpile. So yes.
A follow-up question from Adele.
My question is about the elective surgeries. What types of elective surgeries are you starting with to allow? And are there certain elective surgeries that you find are more pressing than others right now, and why is that?
Answer, John Pryor from Essentia. So the answer is yes, we're trying to be very methodical in how we're approaching this. And again, I want to emphasize that we're starting slowly in the ramp up. We want to start with procedures that don't take a lot of PPE. These are primarily, virtually all, in fact, ambulatory procedures, so things like hernia repairs, things like that. We will then move on to more, to bigger cases, and we have a way of a scale of how we prioritize these. We call these in general time-sensitive cases. So this is where the longer you wait, the bigger the risk there is to the patient, and we'll start with, cases that we know are pressing and where the risk of delaying it is greater than the risk of COVID. And again, I want to emphasize that we feel it's probably safer to be in our hospitals and clinics and a lot of places around the community. So we do want to encourage people to come if they need surgery, if they need a clinic visit. And some of these things are like in particular cancer cases. So we know that cancer progresses. And so both in terms of diagnosis and in treating cancer, those are the types of cases that will be prioritized in this.
Yeah, I would echo again much of what Dr. Pryor is saying. I think we're both using the same process. Our surgical and anesthesia team reviews the surgery schedule the day before to make sure that the cases are prioritized based on their clinical need. So, and again, not to get into the details, but things that were elective or not time sensitive 6 weeks ago just aren't anymore. And that might be a case having to do with cancer diagnosis. It might have to do with loss of function, like in a neurologic case. So again, we're prioritizing cases based on the judgment of the clinicians. So really targeting what's best for patients. And fortunately, the American College of Surgeons and some other organizations have provided really good direction that we can use so that we're making appropriate decisions for our patients. We do, again, have to be careful about big procedures that might end a patient up in a congregate setting, like a long-term care facility, nursing home. We know that those are can be potentially areas where COVID could spread, and so we don't want to adversely affect a patient's health, giving them the surgery that they need. So again, some of those will have to wait, but that gives you kind of a flavor for how we're going to continue the process going forward.
And Brett Scott from Fox 21 asks, more than 1,200 healthcare workers have tested positive for COVID-19 in Minnesota. Have any employees, doctors, or nurses tested positive at Essentia or St. Luke's?
Andrew Thompson here from St. Luke's. I can take that one. We have had a few employees test positive. We know that some of those positive cases were related to travel, and we think that others were related to community spread of disease. Early on, meaning more than a week or two ago, we weren't really testing most community members. We were prioritizing testing for healthcare workers. So because of that, I think in part those positive tests of healthcare workers reflected a canary in the coal mine type situation where that probably represented a lot of community spread. But yes, we have had some positive tests in healthcare workers, but we've fortunately seen significant decline since we've instituted universal masking to keep everyone safe.
Rajesh, would you like to answer that for Essentia? Dr. Prabhu?
I do know Dr. Prabhu was having some technical difficulties.
Okay. I don't know, Dr. Manny, if you know if there have been any cases of employees at Essentia. I'm not aware of any.
I'm not aware of any either.
Let's try and come back to that one if Dr. Prabhu is able to join us and answer. For now, we'll move on to another question from Leanne, who asks, what will be the financial impact after allowing surgeries again? And this is a question for both hospitals.
Well, I can start and say, I don't know. It's got to improve because it's pretty dire right now, not just for Essentia, but for all health systems. I want to remind everyone that Minnesota Hospital Association did a survey, and Minnesota health systems in general are losing approximately $1 billion, $1 billion a month in revenue, and the cost in preparing for the surge is tremendous. So, and when you look overall at health systems, clinic visits, surgery, admissions, even ED visits, they're down somewhere in the neighborhood between 30 to 50, sometimes 60%, depending on the particular health system. So there was an article, in fact, in the paper in the Star Tribune today, and there continues to be articles in various publications about how dire this is for hospitals, and pretty soon the hospital systems, health systems, are going to be on life support, at least some of them. So we are being very careful, as virtually all systems are, in terms of our expenses, hence why we have those special administrative leaves. We're trying innovative processes to reach our patients and provide access to healthcare, like our virtual visits. And actually, Dr. Manny was helped in fact, was a major leader in spearheading that. I think the primary leader. And that's been very successful. When you look at the virtual visits across Minnesota, we're approximately 25% of all virtual visits just from Essentia, and that's because of Dr. Manny and her team. And so we think that this is another step in the improving the access to our patients. So we're happy that social distancing has resulted in flattening of the curve, and that the governor has looked at the data and listened to experts and feels that he can loosen some of the guidelines and allow elective surgery to happen. And so we're pleased that we're going to be able to do this. And we think it will help us, but we're still in a lot of financial hurt. And I know that we're going to continue that throughout the calendar year.
Yeah, it seems like Dr. Pryor and I echo each other's sentiments pretty consistently, but I would just add that St. Luke's is in the same boat. We're excited to, again, start doing more elective procedures, but we know that we aren't going to get back to the number that we usually do. It will be a help, but it will be a help in the setting of some really challenging financial times for hospitals. Again, our focus really is on providing our patients who need the care they need. So we're looking forward to it. It's a positive step forward. But again, overall, considering the health of the region, what's most important is that this is done in a careful way.
I think it's important to come back to this question. I think Dr. Prabhu is able to answer now. Have any employees, doctors, or nurses from Essentia tested positive?
Yeah, hi, Dr. Prabhu, you can hear me, Louis?
We can, yep.
Okay, sorry, it was technical problems. So, I mean, we're continuing to monitor that closely. I cannot give you specific numbers, but I would just say, I think so far so good in terms of there's not aware of any major issues of healthcare workers getting infected, and I think that has to do with our infection prevention measures in place that we do. First of all, the PPE that we use to care for patients, the universal PPE, meaning the universal masking of employees and patients when they come to us, particularly in the outpatient setting, the clinic, or in the hospital. So I think so far things are looking good from that angle. But certainly the volumes of patients that we have are at the point is on the low end because it's not peak surge yet.
Thank you, Dr. Prabhu. Question from Adele.
My question is about testing. Since ramping up testing as of last week, how many more tests have you been able to perform, and how quick is the turnaround on the tests?
Yeah, hi.
I can.
Go ahead, Dr. Thompson.
Yeah, Andrew Thompson here at St. Luke's. We have more than doubled the amount of testing that we've been doing over the past few days. And in part, that's because the criteria have been opened such that anyone who has symptoms can be tested. In addition, we have been testing more people before their surgery, preoperatively. And some of that testing is done here on site. The majority of it is sent out to our reference lab at the Mayo Clinic. And it takes a day or two to get results. So that remains an issue, but one that we're dealing with pretty well, I think.
Yeah, Dr. Prabhu, I would just reiterate what Dr. Thompson said, that our volumes of testing in this Duluth Twin Ports region has increased depending on the day, potentially doubling, but some of those are actually, we do test people that are planning to have surgery. So some of those are people that we don't suspect COVID, but as a precaution, we do test them. And when I last looked at the days of, in terms of what percentage of our patients have positive test results, it's still under 2%, but that also includes people that are asymptomatic in terms of planning for surgery.
We'll go to a question from Brett Scott. Brett asks, after a patient goes through with their surgery, how critical is it for them to remain quarantined or isolated?
Dr. Prabhu, repeat the question, Louis, again.
The question was, after a patient is done with their surgery, how critical is it for them to remain in quarantine or isolated?
No, I think the issue is that we test them before surgery to make sure they don't have COVID, that they're not asymptomatic or what they call pre-symptomatic. And then the typical after surgery hospital course is the same, whether it's a day surgery or you're hospitalized. So there's no extra per se quarantine that we use. We don't quarantine them after surgery.
We have a question from a viewer. Do all patients need to be tested? And Dr. Prabhu, you just kind of alluded to this. Do all patients need to be tested before surgery? And I believe the answer to that question is yes.
Correct, that's our policy. Maybe Dr. Thompson can share their approach. I believe it should be in line.
So Andrew Thompson at St. Luke's. Most elective surgeries, we are testing ahead of time. And really, the specific procedures that have increased risk are ones that we're focused on. Some minor procedures we are not testing because they're not at risk of transmitting the infection. And this may be a topic that we revisit as testing becomes more available and as the prevalence of disease changes in our community. In some areas of the country where there's more active disease, they're testing more people. And so we're closely watching to determine when and if we might need to expand to testing even more asymptomatic people.
I don't see any other hands up or questions in the Q&A box. I will throw it over to any of our doctors in case they have any closing thoughts they'd like to circle back to or points they'd like to finish with.
I'd like to ask Dr. Manny just to maybe summarize again what she thinks are the important points, because I think that their team has been really involved at the national level and locally at looking at the surge. And I know that there's a lot of viewers, I'm sure, with questions about that. And I'm sure they wish we could define when the surge is going to happen and how big it's going to be. But I think that, she's the expert in this. And so I would just ask her or team if they have got any closing comments they would like to make.
Thank you much, Dr. Pryor. I'd like to ask Dr. Steve Waring and Dr. Niall Klein to comment, please.
Sure, Niall, go ahead.
Thank you very much. My name is Niall Klein. I'm the data scientist with Essentia Health. And I think what Dr. Manny brought to the group today in terms of making preparations for a variety of different scenarios and continuing to realize that we are preparing for this to be not a short-term, one-time thing, that we're preparing for the long-term and looking to those different scenarios and those different possibilities as we continue to learn more about how we are spreading the virus in our community.
Thanks, Niall. Yeah, sure, thanks. And this is Steve Waring, and I'm an epidemiologist and a principal scientist at Essentia, and just to echo what Dr. Manny and what Niall said, but I think most of you know by now that models are not perfect, but they're really a valuable tool for helping us to plan, which is exactly how we're using them. And as Dr. Manny showed, we don't expect this to be a one-time really big tsunami peak. We do expect there to be a series, just like you see a wave on Lake Superior, there's more coming after it. Our goal, and we've done a really good job in the state of Minnesota so far, is to make each of those subsequent waves as small as possible, but to learn from what we're doing right now so that we know that when a wave comes that's a little bit bigger than we thought, we need to be very mindful of the fact that our models need to be sensitive enough to be able to tell us when is that point where, like Dr. Van Deelen indicated, when is that point where we need to kind of go back to more strict measures to be sure we kind of keep it under control and keep those peaks as low as possible to not exceed our surge capacity.
Thank you very much. Louis?
We'll see if anybody else has wants to jump in. Otherwise, we can plan to reconvene here again next week at the same time. Thank you to our media folks for joining us and continuing to help us share these messages. And thank you to the doctors for taking valuable time out of their schedules to be with us again today. So with that, I think we will adjourn and we'll be back here again next week. Thank you, everybody.